The first topic we are going to discuss are the major mild neurocognitive disorders due to Alzheimer's. Alzheimer's was previously known as dementia in the DSM-4. The DSM-5 now uses the term major neurocognitive disorder or mild neurocognitive disorder, as there are a few different symptoms and signs that either make you have a major diagnosis or a mild diagnosis of the disorder. Major mild neurocognitive disorders due to Alzheimer's. Symptoms and signs of Alzheimer's to look out for are memory loss. This can include forgetting where your car keys are, forgetting where you are, and it can get more extreme throughout the course. Also, a difficulty in communicating. So this is when somebody knows what they want to say but cannot get the words out and is having trouble communicating with somebody. We also have a sign and symptom to look out for, which would be problems handling daily tasks. This could be anything from doing your daily chores to walking to driving a car, and it could get worse. Next would be confusion. The person could be confused about where they are, confused about who you are, and confused about daily tasks. There's also personality changes. Personality changes could be to go from the severe to depressed, or it could be minor, which could be silly, or very quiet if they're normally a talkative person. There's also mood or behavioral symptoms, which kind of goes along with the personality changes. They could have a depressive mood, they could be angry because they're confused. They could be happy because they kind of are in this heaven where they don't know what's going on. So it could be, it's all depends on the major or mild diagnosis. This disorder also mostly occurs in adults over the age of 65. There is a diagnosis of early onset, but it's very rare. In my slide, I have included a picture of a healthy brain, what a normal brain should look like, and a picture of an Alzheimer's brain. As you can see, the brain kind of looks like it is mush once the person has Alzheimer's disease. It's basically a degeneration of the brain, which we will discuss a little bit more. There are a few neurocognitive disorders that show a connection with Alzheimer's. As I explained in my picture before, there is a degeneration of the brain's frontal lobe. So this happens to everybody, and the disease slowly degenerates the brain, where the person does not really have any memory regarding people, places, things. They may be able to tell you something from a very long time ago, but they may not be able to tell you something that is happening right now. There's also Lewy body disease, or Lewy body dementia. This is an abnormal deposit of protein. This affects chemicals in the brain, whose changes can lead to problems with thinking, movement, behavior, and mood. And Alzheimer's and Lewy body disease can happen together, or one can happen and the other cannot. There is also vascular disease. This is problems with the arteries, veins, and vessels that carry lymph nodes. So this is anything with heart problems. Next would be traumatic brain injury, which we will be discussing a little bit more in our later slides when we discuss TBI. Next is HIV. This is the disease that leads to AIDS, so this can also cause or go right along with Alzheimer's disease. Next is prion disease. This is structurally abnormal proteins. This leads to Creutzfeldt-Jakob disease, Gertzmann-Straussler, Schenker syndrome, fatal familial insomnia, and CARA. And again, this disease can be considered major or mild on its own or along with the Alzheimer's. Next is Parkinson's disease. This is a brain disorder that leads to shakiness, stiffness, difficulty with walking, balance, and coordination. Next, we have Huntington's disease. We actually have a video of Huntington's disease in a later slide because this disease also goes along with traumatic brain injury and concussions. As I've said before, a lot of our disorders presented in this presentation really go along with each other and have a cause of one another. Finally, drugs and medications. The drugs and medications that typically can lead to Alzheimer's or go along with Alzheimer's are drugs that help with anxiety and drugs that help with depression. So the DSM-5 criteria for major or mild neurocognitive disorders due to Alzheimer's has changed since the DSM-4. The criteria are met for major or mild neurocognitive disorders. There are insidious onset and gradual progression of impairment or one or more cognitive domains. For major, it has to be at least 2 to be impaired. Mild, less than that, so just 1. And criteria are met for either probable or possible Alzheimer's disease as follows. For major, probable Alzheimer's disease is diagnosed if the following is present, or it should be diagnosed. That is, evidence of causative Alzheimer's disease, genetic mutation from family history or genetic testing. So we have learned that we can test people for Alzheimer's disease in today's world. So you may have, if you have it that runs in your family, you may or may not have a chance of getting it. It's all about genetic testing. All 3 of these following have to be present. There has to be clear evidence of decline in memory. So this could start off with simple things such as losing your keys or not being able to remember what you went to the store for. Also, you need to have a steadily progressive, gradual decline in cognition without extended plateaus. So you could start off really great with your brain, and then it will slowly get worse with things such as not being able to remember where your keys are, to not being able to remember who the people around you are. No evidence of mixed etiology. So there has to be an absence of a neurodegenerative or cerebrovascular disease or any other neurological, mental, or systemic disease. For mild neurocognitive disorder, probable Alzheimer's disease is diagnosed if there's evidence of a causative Alzheimer's disease, genetic mutation from either genetic testing or family history. So this is the same as the major diagnosis where there's a family history of it, you can get tested, and it may or may not be major or mild, or you may not have it at all. Possible Alzheimer's disease is diagnosed if there is no evidence of causative Alzheimer's disease, genetic mutation from either genetic testing or family history, and all 3 of these are present. 1, clear evidence of decline in memory and learning. So again, you lose your keys, you don't remember what you went to the grocery store for, and then it progresses to not knowing who the people are around you. Next, steadily progressive gradual decline in cognition without extended plateaus. So again, there's a gradual decrease in the cognition of somebody with Alzheimer's. And then there has to be no evidence of mixed etiology, same as in major neurocognitive disorder. There cannot be any other disease that could possibly explain the loss of memory. And this disturbance is not better explained by cerebrovascular disease, another neurodegenerative disease, the effects of a substance, or another mental, neurological, or systemic disorder. So basically, Alzheimer's has to be diagnosed on its own. You should not have any other disorder that may cause memory loss or degeneration. And we will talk about delirium next.